my pride and joy. She my sweet little baby. I'm a little lover boy.
Well, welcome back. It is 9:19 in the heart of the Riverbend on this 17th day of November. Dr. Dorothy Charles from SIHF Healthcare is joining us now to talk about on December 1st. It is World AIDS Day, and they're helping bring awareness with a free HIV screening event at the SIHF Bethalto Health Center. And really excited to welcome on now Dr. Dorothy Charles. Dr. Charles, how are you today?
I'm doing well. Thank you for having me.
No, thank you for joining the show. So, if you, let's just start off with talking about your guys' day of bringing awareness. Is this going to be on December the 1st?
Yep, it sure will be. From 8 a.m. to 4 p.m., we will be hosting a free screening for HIV testing at our health center here in Bethalto. We'll have one of our program managers for our Ryan White program, which is an HIV early detection, community-based early intervention program here on site. His name is Larry Mayhew, so he'll be available to do the HIV testing. And then I personally will be available as well to discuss results with patients and kind of next steps.
Wow, and that sounds like a really great opportunity to be proactive over getting screened and getting tested. And how often is it recommended for somebody that maybe is not required but encouraged to get testing? How often do you guys recommend that throughout the year?
That's a great question. It honestly really depends on the individual. So the United States Preventive Services Task Force, has a once in a lifetime recommendation for anyone ages 13 to 64. So essentially most adults should be screened at least once in a lifetime. Now, if you're pregnant, we do routine HIV testing in addition to other testing with your initial OB labs, as well as in the third trimester around 32 to 34 weeks. And so those are the people who have pretty, well regimented recommendations for when to come in for screening. If you're have increased risk for contracting HIV, however, the recommendation is at least annually, if not every 3 to 6 months. And so the question then is, who is at increased risk? And, HIV is so synonymous with AIDS in our country. I think it's important to kind of flush that out a little bit more. So the important thing to remember is AIDS is a complication of HIV. So when HIV is untreated, your immune system essentially is not functioning the way it should, and it opens you up to a bunch of other infections from things that your body typically is able to fight off. And when you get to that level, then we consider that AIDS. But most people live with HIV with a relatively intact immune system and don't even know it. And people who are at an increased risk of contracting HIV are people with multiple sexual partners, men who have sex with men as a general category, people who've had recent bacterial sexually transmitted infections like gonorrhea, chlamydia, and syphilis. If you're a sex worker, if you share injecting equipment, if you use intravenous drugs, and if you live in a high HIV prevalence area, even if you're not a man who has sex with men. And so I think that's the other thing that gets missed a lot is, even heterosexual people get HIV, and because HIV is so known in the context of AIDS, and that has for so long been associated with the gay community, gay and bisexual community, it's important to recognize that, even people who consider themselves straight, who've only had sex with someone of the opposite or with another gender, are still at risk for HIV if they're not using barrier protection consistently.
Yeah, absolutely. And that's a great point. And I also wanted to jump in and kind of ask you some follow-up questions to that, if that's okay. You hit
Of
on
course.
you hit on earlier with somebody that has HIV might not even recognize it and have a relatively intact immune system. Has there been any studies, or I hate to throw you on the spot here, but it's just an interesting question to me. Is there any correlation to what can cause that change from maybe one day the individual who's never had any complications, never maybe even knew he or she had this disease, and it transfers over and goes into to AIDS. Is there kind of a correlation to when that kind of process happens, or is it different for every individual that's affected?
So I am not an infectious disease specialist, so I don't want to get that out there. But in general, it's hard to predict who will develop more severe infection. What happens is when the human immunodeficiency virus, which causes AIDS if not treated, creates enough copies that it's depleted your immune system to such a degree, then that's when you start having symptoms of AIDS. And so there's good data. The CDC has data about this. 13% of people in the United States have HIV and don't even know it. So that's like a pretty significant number of people, and they estimate 1.2 million people in the United States live with HIV.
Wow.
So, 13% of 1.2 is a good number of people who don't know that they have HIV.
That really is. And have you guys has this kind of been an annual event for you guys at SIHF? Is this something that you guys kind of have been taking pride in, or is this a new venture that you want to keep up and going next year?
To my knowledge, this is a new event, at least at the Basalto Health Center, and I really have to credit my clinic manager, Kathy Sabolo, for, envisioning this opportunity. And, that it's definitely something that we would love to see happen more regularly. One of the beautiful things about Southern Illinois Healthcare Foundation is, as a federally qualified health center and as part of the Ryan White program, we do have funding, federal funding, as well as like state and local funding to support people who may not otherwise have access to healthcare. And that's one of the reasons why I was really excited to work for SIHF when I came out of training. So people who have insurance, lots of these like screening tests are covered by insurance, but don't have insurance.
Dr. Charles, are you still there? Dr. Charles, are you still there? I think we lost you for a couple of seconds. Nope. We lost Dr. Charles. Oh no. But while I have you here, we'll wait for her to call back in. I think something with is going on her end. Great opportunity for all of you that listen. She hit so many great points. Whether it's somebody that's using drugs and using injectable drugs, or anyone in between, it's always a great opportunity, I think, at SIHF Healthcare to get those individuals that maybe over there, get them screened. Maybe they're the only thing I can keep thinking of is not really so much along the lines of same sex partners or anything like that, or same sex relations. It's about the opiate epidemic going on right now. Do we have you back, Dr. Charles?
Yes, we do. I'm so sorry. I don't know what happened there.
It's all good. I really appreciate you calling right back in. And, I wanted to ask you this. And you stated earlier you're not an infectious disease doctor, and I definitely don't want you to, put you on the spot for a lot of this. But I just want to know maybe your thought on it. Do you think with the drug epidemic, the opioid epidemic being where it is right now, and so many individuals falling victim to using those injectable drugs like heroin and so many other things, do you think that's caused an increase in the diagnosis, or just the overall HIV disease spreading?
I'm sure it does. And the other thing to remember is, HIV isn't the only infection that can be spread by sharing needles or other injection equipment. So hepatitis C is another one that can be pretty common among people who use IV drugs. And, I'm a firm believer in harm reduction. And so I understand, addiction is really difficult for people to work through, and there's support for that. We have medications now to help people move away from using IV drugs to something that will allow them to live pretty normal lives just with taking a medication every day, like Suboxone, for example. And we really need to normalize that. And hepatitis C, for example, is something else that could be sexually transmitted as well. And so people who have those risk factors do need to get tested regularly. And that's part of that harm reduction, right? Is, you can use clean equipment, and you can also get tested regularly to make sure that you're not spreading any infections that you may not even know that you have, or that you've contracted something that you didn't realize you were exposed to.
Absolutely. And a couple of minutes left, Dr. Charles. Once again, can you take us through your guys' screening on December the 1st? What time does it start? How long are you guys doing this for? And what else would we need to know?
Yes, that's great. So we start at 8 a.m. and we go until the end of the day, 4 p.m. And all people have to do is call our office. Our phone number is 618-258-8460, and let them know that you are interested in the HIV testing day on December the 1st. Our address is 2 Terminal Drive, Suite 8, in East Alton or Bethalto. We're right across from the airport there, so it's hard to miss us.
That's right. Good landmark. Good landmark.
Yeah, for sure. And we're we're on the side that's right across from the airport as well. So there's multiple entrances to get into our building. And we are under that blue awning. You just go to the desk. The desk will say OB/dental. I'm a family doctor, so even though it says OB, I promise, I also see men. It's not a big deal.
Good point.
I just happen to take over an OB-GYN practice, and I do full spectrum family medicine. So if, for example, that day on the 1st doesn't work for you, but you would like to get plugged in with a healthcare provider, you need some help with getting plugged into insurance. I think that's where I got cut off. We have insurance navigators, and like I said, I see babies, moms, pregnant people, adults, no matter gender, age. I'm here to help folks get connected to the healthcare that they need. And I didn't even get to talk about things like PrEP and PEP, specifically
yes.
PrEP, which is pre-exposure prophylaxis. So if you're HIV negative, but you're still in the high-risk group, we do want to get you connected to things that can prevent you from contracting HIV in the future. And so we have great drugs now that can reduce your risk by 99% of ever getting HIV. So if you're in a higher risk group and you do need to see a doctor about that, you can make an appointment to see me. I don't in this office also provide that care, but I'm sure someone in the SIHF system does. If Bethalto is a little bit far out for you to travel, SIHF has a lot of locations in Southern Illinois. And so that's the beauty also of working for this organization is people can access care that they need where they need it. So, but again, our specific event is happening in Bethalto, and people can sign up by calling 618-258-8460.
Absolutely. And Dr. Dorothy Charles, thank you so much for your time. And I got to reach back out to you maybe for some pediatrician, health segment. I think that would be interesting too. And I really appreciate what you guys are doing on December 1st, with December 1st being World AIDS Day at SIHF Healthcare in Bethalto. You could go for a free HIV screening at their event on the 1st. Dr. Dorothy Charles, thank you so much for your time, and we'll talk soon.
Of course. Thank you for having me again.
Oh,
Take
no,
care.
you too. It's 9:34 in the heart of the Riverbend. We'll take a quick break. We'll come right back after this in downtown Alton.